Now I would like to invite Mr. Shamim Chowdhury, Advocacy Advisor of SNB Netherlands Development Organization, to give his keynote presentation, to give his technical presentation. Thank you.
Honorable Chair, distinguished guests, ladies and gentlemen, a very good afternoon. I'd like to, it's not a presentation, rather I would like to say that it's a discussion among us, because after the great presentation of the General Secretary for the MAP, actually it's something different if we look back to 10 years back. It was not like this. Now the associations like MAP, associations like MUAN, now they are taking these issues very seriously. They're working for this, for the greater interest of the nation. So my views could be a bit difficult, a bit different. The CU-wise, city-wise inclusive sanitation, and how it is actually integrating with the national level. So it's better I walk in the down and talk to you. So you see the in Bangladesh, if I see the context of Bangladesh, we succeed to make the country ODF, that is open, definition of free, and now it is less than 1% if you consider the GMP data, which is actually given data. But around 30% of our sanitation system is due to the containment part. Still we are not in much that good position, so still we are working very hard on this. And the sewers network, which is actually very common in other smart cities and other cities, but for us it's very less. And only in Dhaka metropolitan city, less than 2% is having sewers network, but other cities we don't have this. And still we are very much depending on the emptying, there is the manual emptying in cities. Even it is very much dangerous, very much harmful for the environment, but still exists in many cities, many areas. In most cases, the fecal/treatment plan, which actually is FSTP, is absent. Very recent from the government, from the national government, there are some initiatives, but still it's very new, it's economically very difficult, very hard to manage, and it's expensive. But if I go to the data, if I see the data here, actually, this is the big number that the volume of fecal sludge is producing per year. But if I go to the data here, actually, the volume of the fecal sludge is disposed safely, that is 1%. So it's not a very good data. That's why we're here. That's why we talk on FSM. We came here to learn from others. So this is the country situation of sanitation. The good thing is the open defecation is no more here in Bangladesh. So we are in very good situation. If I see the districts and the cities, you see most of the cities due to the septic tank and the pits, there's some data, we are in a very good position. But in terms of managing the data, in terms of managing this safely managed, we are not in that good position. So what are the common practice in Bangladesh? If you see that this sewer system, there is the offsite system, what I was talking about, is not in that much big in number or percentage. But more we have, there is a septic tank, that is we have more, and the pit latrines, you know very well, in Southeast Asia or Asia we have double pit latrines or single pit latrines, and those actually were considered as on-site sanitation, and that's why from the GMP, the data is showing a bit high. So considering the whole situation, the national government in Bangladesh, we have the initiative to introduce the institutional regulatory framework, in brief we call IRF, and our General Secretary also was talking about the IRF. For us, the national framework has been divided into two parts. One is rural, one is urban. For the urban, there are three IRFs. One is IRF for Purosabhas, one is IRF for city corporations, and one is special for the Dhaka and the mega city. So what we are expecting from the IRF, that is there's a clear assignment and responsibilities has been distributed among the ministries, among the departments, and the specific activities has been assigned to the ministries. And what we are expecting that there will be no overlappings among the ministries. Also, we are expecting that stakeholders from different levels, there will be good coordination on this. So, what we have in the IRF? If you consider the value chain, this is the value chain for the FSA, you see, and all of us are very familiar with this picture, this value chain. There are 15 ministries are responsible for implementing this IRF, and for the containment, collection and transport, treatment, facility and disposal, it's clearly written how these parts will take place. Also, IRF mentioning the capacity building of the municipalities, staffs as well, and the departments and the relevant stakeholders, that also clearly mentioned in the IRF. And also the funding support actually for us in Bangladesh, from the IRF we are talking more about the alternative financing, not from the national government or the revenue, rather we are trying to go with the, maybe it could be a business model, maybe it could be private-public partnership. So that is also indicated in the IRF. Then, what I was talking about the CWIS, that is city-wide inclusive sanitation. The transformation in Bangladesh like this, after the successful implementation of the MDG in 2015, now the new framework has been accepted the CWIS approach, and we are going to a new and wider range of coverage considering the CWIS. Then asked question could be, what is CWIS? There are 7 principles of CWIS, city-wide integrated inclusive sanitation. There are 7 principles actually. So in brief, the principles, if we say, if we focus more on the second one, you see the gender and social equity. That's one of the very important were missing earlier, or even in the MDG time. Then, if we go to the 7, the political will and the accountability, that is the institutes, local government institutes, their willingness, and you saw this morning from the MAP president and the MAP secretary, how they have been committed. They have initiated a cell which will work for gender and equity, considering the sanitation improvement, considering the targeting SDG, and also the comprehensive long-term planning. That is one of the very important issue, because for us, due to the fiscal calendars, due to the fiscal years, fiscal plans, most of our activities are short-term. But the CU is saying that it should be long-term, it should be the bigger one with the big vision. Then, for the CWIS, there's some other great achievement in Bangladesh. That is, we had a FSM support cell, which is under the local government ministry, and under the local government ministry, the local government division, and under local government division, the Department of Public Health and Engineering. So it was FSM support cell. Just a couple of months back, it has been transformed to CUS Secretariat. So that we are closely working, we closely work to closely work with this CUS Secretariat and to considering the CUS principles, so that the changes would be more visible, the equity, the gender inclusiveness, and the other issues, the commitment from the leaders, here should be included here. And from the national government, the recent example is from the DPHE, one big project that has been considered the CUS principles. So, it's another example. We had the National Strategy for Water Supply and Sanitation, and in December 2019, it has been revised based on the CUS principle. I'm not going to the details one, and it's not much visible from your side. So the goal has been reformed, revised, considering the CUS, considering the proper and the inclusiveness as well. And also the proposed strategy that also actually targeting the seaweeds. So it's another example in Bangladesh. Last month in February, we had the FSM National Convention, and the focus was more on the seaweeds. And the achievement, I don't say we have achieved a lot, but the achievement was like this. For the MTers who are the, I would say, key person for this FSM value chain, working for the FSM value chain, a lot of health insurance, they came and they offered the insurance for these MTers. So this is, you see that how actually seaweed is working in Bangladesh. But we are not unchallenged. We don't say that everything is very easy to achieve like the MDG. It took 15 more years, but for the SDGs, already we have passed 5 years, we have only 10 years to go, and the theme of the conference series is the 10 years to SDGs, so we don't have much time, but still we are not unchallenged. So if you consider the challenges in Bangladesh, there is the rapid urbanization, and it says that 38% of the total population will share the urban areas, that is up to 2020. So the trend is quite high. Not only in Bangladesh, global, it's a common trend is urbanization. And another difficulties for us, the translating policies to action, that is yet to be visible. Though we have some policy documents has been revised, we have IRA, we have National Action Plan for FSM, but thing is that in the field, in the cities, that the FSM services are visible, they are yet to see. And we are very much depending on the donor and the loan, because these FSTP issues or safely managed sanitation issues is costly. As I was saying, that it's not that much easy. Technologically, it's also a bit difficult. The operation and maintenance is also difficult. So it's a big challenge also for us. And from the National Bank, they are supporting in many ways, in many areas, especially for the environment. But still, MAB in Bangladesh working with the central bank, so the central bank consider this FSM as green financing. And another big challenge, this is not only for Bangladesh, also for the Nepal and for India and other countries in East Asia, Southeast Asia, that is the topography and the hydrogeological condition. It's really challenging for us. That's why cost comparing other plain lands is higher in these countries. So it's a small picture. The mayors in Khulna last year in April, it was a conference on seaweeds, and they made their commitments. And you see some of the people also here, sitting here. So they committed to achieve the SDG 6.2 by 2030. And you saw the evidences, the live evidences from the General Secretary's presentation, that how MAP has been considering this sanitation issue and how they are taking strong commitment working with the national government or agencies or other stakeholders. So I think it's a good achievement yet, but still we need to see that how much we could achieve within 2030. But there is no excuse. That's the thing. So it's very brief from my side, and thank you very much for your passion sharing. And I'll be happy to answer some questions.
Request our guest of honor for the session, Dr. Barnadia Iravati, to deliver her speech, and she is the Secretary General of UCLG ASPAC. So please give a big round of applause for her, for our guest of honor.
Very good afternoon. Namaste. Namaskar. Actually, many of us were here yesterday in this room. We discussed about gender equality and women empowerment. And we all asked that we need more and more voices from the women on gender equality, and we asked for 50% quota for women representation in politics at all levels. You know why I brought up this issue? Because this also relates very much on the SDGs, what we are talking about. SDGs number 6. So many women also do not have good access on sanitation and water. And when we look at, if we do business as usual on SDGs, this SDGs number 6 will not be achieved. So when I look at all three very handsome gentlemen here, Mayor of Nepal Mari, Secretary General of MEP, and also Co-President of UCLG ASPAC, I see them as champions of sanitation. Why we implement this program? Because we need to speak louder. So this is why they have additional mandates of speaking louder on sanitation. I think you have been doing it, like Mayor Asok has been able also to meet with the minister, even with the Prime Minister, to highlight this importance of sanitation. You all play very, very important role, because I consider what comes out from your mouth is a gold. Why I say gold? Because it's so powerful what you say, all the mayors here. And you should be very fortunate because you have municipal associations with you. There are many countries in Asia, of course in the world, that do not have association. Laos has no association, Myanmar has no association. But you, very important countries in Asia, Bangladesh and Nepal, you have very good associations as a platform for you to interact. When I was in Indonesia 2 weeks ago, I had a chance to meet people from the Ministry of Home Affairs. They said to me, because Indonesia faced decentralization, let the associations grow by themselves, let associations empower themselves, we might not need to have them much financially. So, in one side, you need decentralization. But in another side, you also need enabling environment. But I think compared to association in Indonesia, this MUAN and MAP are more powerful in terms of convincing the central government to work with you. Prime Minister also went to one of the sessions, the events, and also the Minister of Urban and Water, lady in Nepal. So you on one side, you managed to speak louder on the importance of sanitation. So please don't stop saying how sanitation and water is important in your city, in your region, until you achieve this SDG number 6. Most of you have been facing solid waste management. How you manage solid waste. When we talk about 6, I think many of you have a problem of waste. You maybe in some countries or some cities, you spend almost 50% of your budget in doing solid waste management. Because we tend to always respond, not looking at the grassroots of the problems, on the root of the problems. So what we have been already sharing information that this waste is money. Like we had also discussion with people in Indonesia of medical waste. Medical waste is profitable. So this is why do not think of the money as a problem, but find way to connect to the financial resource, including private company. I think one of the things that we have not done in this project is the financial options on the sanitation and fecal sludge management. We want to do and want to create PPP framework, business model for fecal sludge management. You should count the amount of fecal sludge in your cities and how much job you can generate. This is profitable. The thing is that we just don't trust ourselves. We might be not confident enough in telling the people. If the demand is high, the people will look for it and also waiting for the services. So I don't know when are we going to come up with this business model. I think by soon. So by May we should be able to do that. So let me say again by thanking all of you. I see a lot of mayors here and I consider you also champions. Champions on the sanitation and fecal sludge management and of course with the support of all the women mayors here. So thank you and have a nice day and we have a good session also tomorrow. Thank you.
Now to Miss Sushila from then to Mr. And lastly, a very big round of applause for our. So now our next session is on circulation.
Bye. Oh,